Since I used a non-water-based brushless scrub, I really don't need my towel that's laying there on the top of my gown. So what we're gonna do is pick it up right in the center, making sure that you don't touch anything else, and then you're just gonna toss it off into the trash, okay? Making sure that you don't get too close. Now remember, when you pick up the gown, you wanna make sure you're in the center of the gown, making sure you don't get a thumb around the edge. So you're gonna pick it up, and then step back. Okay, you allow the gown to open. You're gonna go in with one arm, come down to the belly, making sure you're not too high near your neckline. Go in with the other arm and come down to the belly. And then your circulator is gonna come in and tie you. Now, remember that your fingers cannot go through the white cuff. We're gonna approach the Mayo Stand. You can kind of tuck your white cuff as you're messing around to try to get your gloves so that your white cuff isn't hanging over the edge. Okay? So remember, we don't wanna shift that wrapper at all. So you're gonna open up your gloves, grab whichever glove you're used to gloving first. You're gonna position it on your arm so that the fingers are towards your belly, so that the thumb is down on the hand that you're going to glove. And then you're gonna grab the ridge and flip it over, and then slide your hand the rest of the way in. Grab your other glove, making sure that you stay back from the wrapper so that the front of your gown isn't too close to any of these unsterile areas which are up here on the wrapper. And then don your second glove. Now, before we approach the back table to put your second set of gloves on, you want to make sure that you spin your gown. So we want to hand it to the circulator so that we're facing the back table in the sterile field, and then they're going to come around you. And then you're going to tie. Okay. Then we approach the back table and don our second set of gloves. All right. So once we have a space on the back table, we want to make sure that we get our instrument set on right away. You can ask your circulating nurse to get rid of that trash that's on your Mayo Stand. Thank you. Okay. All right, so when we come over to get the instrument basket, we want to make sure that we watch the front of our gown by any of these unsterile areas that are on the front of the Genesis band and also the ring stand here. You're going to verify the indicators on the inside. If they're flipped over, you're going to need to find them and turn them over so that you can see both of them. But you have to make sure that you don't touch this outside edge of the Genesis pan because that is contaminated. So you always want to go to the inside. So you're going to have two indicators that you need to verify. So I see both of them are good into the safe zone. And then you're going to lift your basket up, hold it away from your gown, and then your circulating nurse is going to come in and check the bottom filter. Good. And then we're going to set that on the back table, on the edge of the table that's going to be furthest away when we pull up to the field, because the items that stay inside that instrument basket are the things that we use least often during the case. You're going to pick up the basin, put it opposite the instrument basket, and then you're going to start to kind of organize the contents of the pack here. Remember, the goal is to touch something once and put it where it's going to be. So if you touch it, you want to make sure that you're doing something with it. Okay, so we have gowns and gloves for our assistant and our surgeon. So you want to stack those in the order in which you're going to use them. So a towel, a gown, and then gloves. And you can take those and either place them beside the instrument basket or behind the instrument basket, just making sure that they don't hang off the back table. You're going to have 4 towels plus your laparotomy sheet that you're going to place in the basin. So you want to pick those up and make sure that you shove those down so they're not hanging over the side as well. We're going to need 2 towels plus our Mayo cover and our trash bag or our suture bag to drape our Mayo Stand, and then we'll need 3 towels for the back table. Any extra towels you can just put over here in the corner beside the gowns. Then you're going to drape your Mayo Stand. So there's 2 techniques to drape the Mayo Stand. You can either use the belly up or the 2-handed method where you go to the side. But you want to open it up where it says left hand, right hand. You want to insert your hands, making sure that you grab all the layers. You want to give yourself a large opening, but make sure that you don't flip your Mayo cover up so it might potentially contaminate against your mask. Okay, you want to make sure you put a foot on one of the feet of the Mayo Stand. Start to slide that cover on. If you are going to use the 2-handed technique, Make sure you don't turn this way so that you get your back to your back table. Make sure you turn out to the side. And you can open up that mayo cover and slide it the rest of the way on. Once your mayo is draped, you should bring it right up to your back table so that nobody's going to walk between the two sterile fields. We're going to place 2 towels on the Mayo Stand. Okay, remember we want the overlap of the towels to be to what will be the back edge of that Mayo Stand, or what will be towards the patient's feet when we pull up. So we have 2 towels, and then this will be our back edge where our ringed instruments go. All right, then we want to put on our suture bag. So that's going to go on that edge of the Mayo Stand where you're going to stand, which is going to be back here on the pole edge so that you can control the raising and lowering of that Mayo Stand. Okay. We then are going to lay out our towels. So we want 1 towel that starts on the edge of the table that's closest to us, then another towel more in the middle of the back table. And then you're going to make a roll towel. So fold in your edges, roll that roll towel, and then place it about in the middle of your workspace. Okay, we're then going to organize the contents of the basin to get ready to perform our count. So again, remember, if you touch something, you want to put it where it's going to be. So suction, cautery, light handles kind of at the center of the back table. Your basins will be aligned along the back edge of the back table. Okay, my cup over here as well. Your pitcher. You're going to take your needle book, split it in half. The sponge portion is going to go up on the Mayo Stand on the edge that's furthest away from you where you stand towards the back. Keep the magnet portion on the back table. You put the knife protector up on the Mayo Stand on the edge that's furthest away as well. As you have your suture here, you're going to go ahead and put it in procedural order so that the last suture that's going to be used is on the bottom, the first suture that's going to be used is on the top. So we'll have a 4/0 vicryl on a cutting needle. This happens to be an FS2. It might be a PS2 or a PS1 or an FS1. But we'll put that on the bottom because that'll be for my skin. I then have a 3/0 on an SH for my sub-Q. I have an O vicryl on a CT1 for my muscle fascia closure. I have a 2/0 on a CT1 for my peritoneum. And then we just happen to have an O vicryl CT1 multi-pack, and we'll just call that our procedural stitch. So we want to have that on top. And then you just have the suture that you opened when you went through your case card. Okay. So I have my scratch pad over here, my marking pen, my syringe. I want to keep all my sponges together because they're going to be counted at the same time. And then your package of ties, because it's not a counted item, can go ahead and go right up on that Mayo Stand underneath that fold. Okay, once I have everything organized out of the basin, then I'm going to organize the contents of the instrument basket. At some point, you want to make sure that you throw your indicators away. So we're going to put those into our suture bag. You don't want to leave your back table, but that way they don't go back through sterile processing and cause somebody to think a set is sterile that isn't. Pick up your rack of ringed instruments, place it on your back table so that the curves are facing the front of the back table. The smallest ringed instrument is closest to the small counted items. So in this set, it happens to be mosquitoes. You're going to pull your instrument stringer off, place it underneath the instrument basket, and then you're just going to organize everything else that's in here. So I have a Balfour body. I'm just going to pull that out. I have my side blades for my Balfour, which I'm just going to hang off the side of the instrument basket here. And I also have my bladder blade. Remember that the Balfour is going to be counted separately from the rest of the retractors, so we want to make sure that it's separated out. You're going to find your forceps, and you really want to minimize the amount of movements that you're having at the back table. So pick up multiple items before you make movements someplace else. Okay, so I have my forceps. Then I'm going to organize in pairs behind my rack of ringed instruments. Most people will put their atraumatic forceps on one side and kind of organize them in order by size. So I have DeBakey's and Russians on one side, and then I have my tissue forceps with teeth, my Ferris Smiths, and my Adsons with teeth on the other side. It doesn't matter which direction they face, but they all need to be facing the same direction, and they need to be neat and organized so that they can be easily seen by your circulating nurse as you perform that initial instrument count. We then need to organize the retractors and everything else that's inside the instrument pan. So you'll have a suction tip. So we have a yank hour with a tip that is removable, so it should be taken apart as it's sterilized. You can put it together at this time to make sure that you don't lose that tip, but make sure that you count both of them as 2 pieces when you count your suction tips. Okay, so we'll just kind of lay those right here on the working space. We have a couple of knife handles that we're going to put over here by the small counted items. We'll use those when we count. And then for the rest of the retractors that are in here, there's 2 techniques to organizing them. You can either leave them in the pan and organize them like this. You can kind of use the handles as an extra surface and then just hang your rakes and things off the edge. Or if you prefer, you can take and just hang all the retractors off the edge of the instrument pan like this. For some of your smaller retractors, and then of course your Harrington and your Deaver and your ribbons are going to have to stay inside the basket. So it doesn't really make any difference which technique you want to use, but we do want the sharp retractors up off the edge, because that way you don't want to take your hand and stick it inside your instrument basket and then get poked by one of those. And you really should have the sharps facing away from the field so that your Gelpie isn't facing this direction. And we should also make sure that everything is closed. That way when we transfer it up to the Mayo or up to the field, it's ready to go. Okay, at that point, you're going to perform your initial count with your circulating nurse. So you'll let your circulating nurse know that you're ready to count.
Okay, I'm ready.
Okay, so we're going to start with our sponges, and we always count our sponges largest to smallest. Remember that we don't break the paper strip on the outside until right before we count them. So we state the name of what we're counting. So we have laps, and then you separate them out. 1, 2, 3, 4, 5. Next we'll do Bratex. So I have Bratex 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Peanuts, I have 1, 2, 3, 4, 5. Next we're going to go on to atraumatic needles. So that's going to be your suture needles. So I have 1 in here. If you have a package like this one where you can't see the needle, you need to make sure that you open that up. And as you count your needles, you want to make sure that you're using something besides your finger to point to them. So we have 2. If you have a multi-pack with a paper on the top, you make sure that you take that off. So we have 3, 4, 5, 6, 7, 8, 9, 10. And I have 11, 12, 13, 14. Okay, and then we'll go on to sharps. So for sharps, we're going to count our blades, our hypo needle, and our cautery tip. So I have 1, 2, 3. And on your cautery tip, make sure you pull it out of the holster so that the circulating nurse can see it. 4. And then we're going to count our scratch pad next, which we count it separately from our sharps. So we have 1 scratch pad. Next, we're going to go on to our ringed instruments. So if you're right-handed or left-handed and you would like your circulating nurse on the other side of you, just ask them to come around. So could you come on this side? Okay, because we need to make sure that we open up so that they can see what we're counting. All right, so we'll start with mosquitoes. So we have 1, 2, 3, and 4. I have Kelly's 1, 2, 3, 4. Mayo's 1, 2, 3, 4, 5, 6. Making sure you state the name, then count the items, and remember that the longs and shorts of each type are going to be counted together. Alice's 1, 2, 3, 4, 4, 5, and 6. Coker's 1, 2, 3, 4, 5, 6. Babcock's 1, 2, 3, 4, 5, and 6. Hats and tonsils 1, 2. Right angles 1, 2. Ring forceps 1, 2. Needle holders 1, 2, 3, 4. Scissors we're going to count all together 1, 2, 3, 4. And then towel clips all together as well. So 1, 2, 3, 4. Next, you're going to go on to whatever is directed by your circulating nurse or whatever you direct them to. We just make sure that we count the ringed instruments first, and then you want to just proceed in an order that is going to allow you to not forget anything. So let's go to forceps next. We're going to count them as a group. So I have forceps 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Suction tips, I have 1. Remember to count that piece that comes off the yank hour. 2, 3, and 4. Okay. count the valve 4, so we count it as the body, the wing nut, and then the blades. So I have 1 valve 4 body, I have 1 wing nut, and I have blades 1, 2, 3, 4, 5. Our retractors, we're going to separate out our handheld from our self-retaining. So I have handheld retractors 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And I have 1 self-retaining retractor. And then don't forget about your knife handles. So I have 1, 2 knife handles. Thank you. Yep. All right, so then we're going to start to set up our Mayo stand. So the first thing you want to do is load your blades. So we're going to load 2 number 10 blades. So remember, you want to have a skin knife and a deep knife. So most people use a needle holder to load their blades. You can use a Kelly or some other clamp as well, but a needle holder tends to work best because it does have the inserts on the inside that help to prevent the slipping of the blade. So we load both of those, place those on the Mayo stand in the knife protector with the blade down on the edge that's furthest away from you. Remember, we always place our sharps on the edge that's furthest away. That way when you stand up at the Mayo stand, you're not going to put your hands in your sharps. So since I have a needle holder in my hand already, I'm going to go ahead and load my first suture of use. Okay, so we want to load it so it's 2/3 of the way from the tip or 1/3 of the way from the swedged end, and you want to angle it up at about 30 degrees or so. And we're going to load it for a right-handed surgeon. So for the right-handed surgeon, you want to have it so if they put it in their right hand, the tip's going to poke them in the nose, and the suture comes out to the right side. Okay, make sure you contain your suture before you walk up here to the Mayo so it doesn't drag down below a sterile level. We're going to rest that on the needle book so that the tip is down, not pointing up in the air like this. You want to have the tip down so that somebody doesn't get poked. Then you're going to grab your basic ringed instruments. So we're going to do 2 Kellys, 2 Mayos, 2 Alice, 2 Coker, and 2 Babcock. As you pick them up, you want to grab them by the tip, close them to the first ratchet, and you want to make sure that you keep them in the order that they are on the rack, because that's the order that they're going to be counted in. So that's the order we want to keep them in when they're up on the Mayo stand. Okay, so again, 2 Kellys, 2 Mayos, 2 Alice, 2 Coker, 2 Babcock. Then you're going to grab a right angle because we're going to load a tie and a passer. You're also going to grab your basic scissors, which is going to be a Mayo, a Metz, and a suture. Okay. So the goal, again, is to make minimal movements to the Mayo stand. So you want to try to grab as much as you can, but not too much that you're going to drop things on the floor. So if you still have room, you can pick up your medium DeBakey's, which are going to be the longer DeBakey's that are in the set, and your tissue forceps with teeth. And then we're also going to grab two Army Navy retractors. So the Army Navies will go in the middle of the Mayo stand. The forceps are going to go on the front edge. It doesn't matter if you leave them stacked inside each other or if you want to set them beside each other. Either way is fine. You're going to pull your scissors out. Make sure that they are closed. Everything that's handed up to the field is closed, so it should be closed on the Mayo so that you can just pick it up and hand it up to the field. We pull the right angle out because we're going to load a tie for a tie and a passer. And then the other ringed instruments go off the back edge of the Mayo stand. Smallest ringed instrument closest to where you stand curves going towards you. So it should be Kelly's, Mayos, Alice, Coker, Babcock this direction. You're going to pull a tie out of your package of ties and load that onto your right angle. And we're going to place that beside the loaded needle on the needle book. And again, we have that package of ties right underneath that overlap of the towels at the back of the Mayo stand. All right, then we're going to finish the Mayo with the things that we need to hook up to the field after we get the drapes on. So you're going to put a couple of dry laps up here, put your light handles up, and then you're going to get your cautery and your suction ready. So you probably want to get your suction ready first because we want to make sure that we hook up our cautery first to the field, so that way we have the cautery stacked on top. So in order to get the suction ready, you want to have about an arm's length from the center of your body out, making sure that you're not getting too high or too low or allowing any portion of this to fall below the table level. Okay, for a laparotomy, we're going to use a pool tip, but we don't use the sheath until later on. So we're going to put the pool tip on and then put a non-perforating towel clip at that level that we've determined that we want to keep on the field. Now this is going to move, and that's fine. It just gives you an approximate of how much you want to keep up on the field. And then put your pool tip on, kind of make sure that it's not all tangled up so it's easy to hook up to the field, and then set that up on your Mayo. Just make sure that it's not setting on any of your sharp items. That way when you pick it up, you're not going to take a sharp with you. We're going to do a similar thing with the cautery here to determine how much we want to keep on the field. So it's about an arm's length from the center of the body out this way. Where you have the loop, you then are going to pass it from the back of the cautery holster around the bottom and then pull it up tight. You're going to take the active electrode or the pencil and the cord that's going to stay on the field, wrap that back up, and then put it back inside the holster. We're then going to take a non-perforating tail clip and just kind of hook it on the holster, making sure that you don't clamp the cord. And then all of the cord that's going to get tossed off, we just leave out to the side so that we can toss it off when we get up to the field. And make sure that you take your scratch pad and place it on the front of that holster. I did knock a suture off my field here, so I'm going to need another one of those sutures that I knocked off.
Okay.
Okay. All right, so we'll just place that up onto the Mayo stand on top of that prepared suction. All right, after these items are done, then we're going to start to do some of the other ancillary duties. So the order of these ancillary duties doesn't really matter, but you do have to have the Mayo stand finished before you start to do anything else. Okay. All right. So we're going to load a peanut on a long Mayo. Thank you. You're good. Okay, thank you. So our count will be the same since we lost one and then added one. Okay, thank you. Okay, so we're gonna place that peanut on the roll towel beside the mosquitoes here. You're gonna load a sponge stick, so we're gonna grab a ring forceps, grab a Ray-Tech, fold it in thirds so that the radio pig strip is showing on the top. So fold it in thirds and then fold it in half, and then load it on to that ring forceps, and again place that right beside the mosquitoes on that roll towel. You're going to take your adds and forceps in a pair and move them over beside the sutures, so that way at the end when we bring our closing stitches up, we have our adsons to bring up as well. You're going to get your balfour ready by choosing the appropriate blades based on the size of your patient. So we'll say we had a larger patient, so I'm going to pick my larger side blades. There's a hole right here where these pegs need to fit in, so you want to make sure that you slide those on so they actually lock onto the body. So remember that the wing nut needs to be up, the blades need to point down, and they need to pull in opposite directions from each other. And then you're going to squeeze this little lever right here to make sure that this is closed, because when we hand it up to the field, it's going to be placed in and then opened up inside the wound. So it needs to be closed on your back table. Okay, then you're going to get some solutions on. So we're going to get water, saline, and a medication. Okay, so I'll take water in my large basin here. Sterile water, January 7th. Great. Okay, so that's perfect. All right, so make sure that you create your label right away. Now for the water, we just need one label because we're not going to put it in any other container. And you do need to include the amount. So that was 500 mLs. Yes. Okay, so we're going to put that on here. So saline.
0.9% sodium chloride, October 16th.
Okay. Make sure that you don't turn your back to your back table if you choose to pick up your containers. We're going to double fill the asepto as well. Okay, so remember you push back, and then you're going to tip it back, and then push down on the back of the bulb again, and then tip it back into the pitcher. We need two labels now because I have saline inside my asepto and then also inside my pitcher. Okay, so I have saline, it was 0.9%, so I had 500 mLs, and then I have 0.9% on my asepto as well. And make sure that you're using the saline for irrigation label, not the injectable saline label, which is often found on the pre-printed labels. Okay. Now, when you place the label on the asepto, don't put it up here on the bulb, because when they squeeze it to irrigate, it's just going to come off. You will see that a lot of people in the clinical site will just write directly on the bulb. We don't do that in lab just so that we can preserve the supplies to use them again. Okay, I'll take a med.
40% marking with MB, 1 to 200,000, 30 ml.
Okay.
March of 15.
Okay.
and I pre-drew this. So.
Okay. So remember, there's 3 ways that you can get your medication on. Your circulating nurse can either draw it up into a syringe, which is the way that we're going to get it on this time. They can utilize a Vialojet, which goes into the top of the vial, and then they can pour that on, or you as a surgical tech can draw it up from the circulating nurse, utilizing a syringe and a needle into the vial of medication. Perfect, thank you. Now, because it is a lot to remember, they can always show you the vial again if you're not sure. So if you're not sure if it was 1 to 200,000 or 1 to 100,000, just ask to see the label again, okay? Make sure that when you're writing your labels that you don't lean over your table, so force yourself to stand up. Remember that when we write this label, there's always a 0 before the decimal point, but there's never a 0 after a decimal point, and there's no commas. Okay, so we had 30 mLs, so I need that on my label for my med cup. And then I need a second label because I'm going to draw my medication up in my syringe. So label my med cup. Label my syringe. Make sure when you put the label on the syringe that you don't cover the calibration so that you can see how much you've used. You're going to fill your syringe to 10 cc's or 10 mLs. Okay. Now, if you have a bunch of bubbles down here at the bottom, you can use your finger to flick your syringe. However, if you think that's painful, you can use an instrument to tap on the bottom, and that will send those bubbles to the top as well. Okay. Once you get the bubbles at the top, you want to make sure that you hold the syringe up and then push up on the plunger to get rid of the air. You want to read your plunger from where it hits the side of the syringe, not from the point in the middle, as that's what compensates for the amount that's left inside the tip of the syringe up here. Okay, if you need to get more to make sure that you're at 10 cc's, just refill it back up. And then you're going to add your hypo needle so that it's ready to use. Okay. You're going to make 1 wet lap by dipping a lap into your water, wringing it out as much as you possibly can. Opening it up all the way, folding it in half, and then rolling it so that that radiopaque strip is exposed, and then you're going to place it in your emesis basin. Now, for a laparotomy case, we would make several of these to use inside the peritoneal cavity, but for your competency assessment, we'll just want you to make one just so you can show us how to make it. Okay, at that point, then you're going to be ready to gown and glove your surgeon, so you can bring their items up to the front of the field. All right, so you're going to introduce yourself. I'm Casey Glassburner. I am a surgical technology student at SCC.
I'm Casey.
When you open the gown, make sure that it's away from your gown so it doesn't get contaminated. Make sure you cuff your hands. Make sure you hold it up high enough too that it's not going to drag onto the floor, and make sure that you're not going to go too high near their neckline. You're going to pull their sleeves back, making sure that you're not too close to that white portion on the sleeve. So be back further on their forearm. And then you're going to glove them. Remember, when you glove them, you want the thumb to be towards their belly. You want to give yourself a good cuff at the top so that your hands are protected. And then also make sure that you don't just let the glove go so that it doesn't come back and snap them at their wrist. You're then going to spin around. Okay, so they'll hand you the card. We always take the card off the tie as a sterile person so that we don't risk having that fall down and then become contaminated. All right, so together we're going to drape. So you're going to bring your basin up towards the field. Okay, so we assume that the patient has already been prepped at this point. Make sure that you get far enough away from your back table before you turn your back. You are going to have to turn your back eventually to the back table because we do have to drape this patient up here. But I'm far enough away that I know I'm not going to back into that back table. Now, when you bring this up, make sure that it's not too close to these unsterile portions, the linen or the bed or any of these things. So make sure that it's far enough away. You're going to pick up a towel, make about a 2-inch fold that's away from you. Cuff your hands so that they're protected, and then we're going to approach the field making sure that I keep my hands protected so I'm not going to touch anything that's unsterile, and also watching the front of my gown to make sure that I'm not too close. Now, don't open this towel up. Just place it and back your hands away. Now remember on the towels, you can always move them away, but you can't move them towards so that we're not bringing something that's contaminated back up to a sterile level. So again, on this next one, we're gonna place the top or the bottom. It doesn't make any difference, but when I swing out, I wanna make sure that I'm isolating off anything that's unsterile. So we shouldn't have any of the patient's linen or their gown showing on this side where we're gonna be making the incision. Remember, the size of the area that you're squaring off is about the size of the fenestration or the opening on the sheet that you're putting on. So we're putting on this laparotomy sheet here. So this is about the size that we're going to be squaring off. Okay. On the last one, the fold is going to go towards you. Make sure that you don't drag this on any of the unsterile areas. Reach across. Now, a lot of times you're going to be draping with somebody else. Okay. Now, I lost my towel, so we're just going to let it go. Grab another one and place it where it's supposed to be. All right. So then you're going to pick up your laparotomy sheet. So they'll oftentimes have a picture of a patient. So you want the head towards the head, the foot towards the foot. We're going to bring this basin back to your back table so that it doesn't get contaminated. You're going to ask your surgeon if they want stickies on or stickies off. Stickies on, please. Okay. Which means to leave the paper on so that the adhesive is covered. We're going to position the fenestration over the area that we've just squared off. If we had exposed the adhesive, this is when we would stick it down. Okay. We're then going to open it up, making sure that we don't allow any of the layers to drop. We're going to go towards the feet first. So we're going to grab that top layer, cup our hand to the inside, and extend out, and let it drop. And then this drape happens to have armboard covers, so we want to make sure that we open those up. We're going to cuff our hand to the inside again, and then bring our other hand in and hold on to the drape so that it doesn't shift the fenestration, and wait for anesthesia to attach it to the IV poles. That way we don't allow it to fall down and then bring it back up to a sterile level. This paper just protects the incision site as the drape has been put on. So you can just hand it off to your circulator, or you could also just put it in your basin right now. We're going to grab our Mayo Stand and bring it in over the field. Make sure once you get it out and away from your back table, you're then going to get behind the Mayo. You're not going to be backing up to the field like this. Okay. If your Mayo cover wasn't pulled down in the back, make sure that you ask your circulating nurse to pull that down before you bring your Mayo in over the patient. Okay, so we're going to go all the way in over the patient, and we always put a hand underneath to make sure that the Mayo Stand isn't resting on the patient. Hand your light handles to your surgeon. Then you're going to attach your cautery. So you need to look and see where your cautery machine is, and it looks like it's off to that side over there. So you want to position the cautery so that it's to your surgeon's dominant hand, and the way we know that is by which hand you glove them first. So she was right-handed, so I want to have it on this side. And I want to have the clip on the side that's going to be opposite where they're going to be working so that it's not in their way. So she's going to be standing here, working with the pencil on this side, so I want to make sure that the clip's on the opposite side. Okay? Keep the cord up on the field until you get it attached to the drapes, and then just toss it off the field on that side. We're then going to attach the suction. So again, you want to look and see where your suction tree is. So it looks like it's on this side over here. So we want to keep the amount that we've determined we want to keep on the field. Now this drape happens to have these Velcro adhesive portions on them, which is very nice. You can use those. If you had a drape that didn't, you would be utilizing a towel clip though. So we'll show you how to use both. So if I want to use the Velcro, I'm just going to take my suction and just put it inside the Velcro, secure that up here, and then you would toss it off. However, if I'm going to be utilizing my towel clip, you can take and just wrap the drape up around that suction tip, or that suction tubing, excuse me, and then make sure it's out of the way so it's not going to be impeding anything or having items get caught on it during the case, and then toss that off the field. Making sure that you're facing where you're looking, making sure your hand doesn't get too low, down below a sterile level, and making sure you're not reaching behind you. Also make sure that you watch out your patient's face is up here towards the head, so you don't want to have any items on the patient's face as well. All right, we're going to place 2 dry laps on either side of the incision. Then you're going to bring up your back table. Okay. Remember, when we move a back table, you don't grab it underneath. You're going to place your hands on the top. You can kind of get it started with your foot. If you're struggling and you feel like your cover is shifting, you want to make sure that you ask someone who's unsterile to help you move your back table before all of your items end up on the floor. Okay, so the back table comes up, positioned so it's not behind you when you're standing at your Mayo stand. And then the basin, when we move it, we want to make sure that the hands are on the inside, not wrapped around the edge as well, and then bring that up again at the end of the back table. Okay, you're then going to verify a timeout before you hand a knife. Okay, so has the timeout been done? Yes, it has. Okay. Then you're going to hand a knife. So again, remember they're right-handed, so you're going to hand with your right hand, making sure that the sharp is down, hovering underneath the palm. So you're going to hand that up to the field. Okay, and lay it down. You pick it up and you put it back on your Mayo stand right away. Okay, that's when your time stops. So remember, you have 45 minutes from when you open the back table until you hand the knife. At that point, we're going to assume the procedure is done. So they're going to be closing up the field. So they're going to have a suture loaded in the needle holder, a forceps, and then the suture scissors up on the field as well. Oftentimes, a lot of times they will toss off a sponge or something like that too, so that you do have to count the floor when we do the closing count. So then we're going to perform our closing count.
You ready to count?
All right, yep. So we're going to count the items in the same order that we did the first time, but we want to make sure that we always count the field, the Mayo, the table, and then the floor for any items. All right, so we'll start with our laps.
Yep.
So I have one lap up, right up here.
One.
Here's two, three, and here's four, and then I have one on the floor over here for five.
For five.
Make sure that you don't
There
drop
we
your
go.
hand down when you're counting that item that may be on the floor.
Okay.
All right, Ratex. Okay, I don't have any up, so I can start back here on my back table. So I have 1, 2, 3, 4, 5, 6, 7, 8, 9, and here's 10. Peanuts, I have 1, 2, 3, 4, and 5. All right, atraumatic needles. I have one up on the field. Here's 2. Here's 3, 4, 5, 6, 7, 8, 9, 10. And here's 11, 12, 13, and 14. Okay, for sharps, I have one up on the field here.
Okay.
Here's 2, 3, and here's 4.
Okay.
And then I have one scratch pad on my holster as
One
well.
scratch.
Okay. All right, so let's go on to instruments. So we're going to start with mosquitoes. So I don't have any up here, so I'm just going to start back here on my back table. Okay, so mosquitoes, I have 1, 2, 3, 4. Kelly's, I have 1, 2, 3, 4. Mayos, I have 1, 2, 3, 4, 5, and 6. Alice's, I have 1, 2, 3, 4, 5, and 6 here. Let's move those over. Cookers, I have 1, 2, 3, 4, 5, 6. Babcocks, 1, 2, 3, 4, 5, 6. Ads and tonsils, I have 1, 2. Right angles, I have 1, 2. Ring forceps, I have 1 here on my sponge stick, and here's 2. Okay, needle holders, I have 1 up the field. Here's 2, 3, and 4. Scissors, I have 1 up. Here's 2, 3, 4. And then towel clips, I have 1 on cautery, 2 on suction, and here's 3 and 4. Forceps, I have 1 up. Here's 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Suction tips, I have 1 up. Here's 2, 3, and 4. I have my Balfour body, 1 wing nut, and blades 1, 2, 3, 4, 5. Handheld retractors, I have 1, 2. Here's 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And I have 1 self-retaining retractor, and I have 1, 2 knife handles.
Okay. Count is correct.
Perfect. Okay, after that, you're going to tell me what your med is and what its class in action is. So we have 0.25% bupivacaine with epinephrine. So you really have 2 drugs. So we have bupivacaine, which is a local anesthetic that we use for numbing or pain relief. And then we have epinephrine, which is a vasoconstrictor that we use to decrease bleeding and also prolongs the effectiveness of the local anesthetic. And then you will tell me 5 duties that you have during the postoperative phase after the patient goes to PACU to break down the sterile field. So we're gonna care for the specimen, make sure the sharps are contained within the needle book, and then place that in a sharps container. We place the used instruments either in a basin of water, or we place the unused instruments, a towel, the used instruments on top, and then spray them with an enzyme cleaner. We're gonna make sure that all the biohazard goes in a biohazard bin. We're gonna make sure that all the trash goes in the trash, the linen in the linen, wipe down the room. There's about 30 different things that you could list. So you're just gonna list 5 things that we do to turn over the room after the patient goes to PACU. And then you'll take off your gown and gloves, you'll pull a number for a procedure, and then you'll identify the procedure suture for an abdominal hysterectomy, an inguinal hernia repair with mesh, a bowel resection with anastomosis with suture, or a cesarean section, where you'll pick out the suture out of suture that's laid out on a table, identify what sutures are used, and then also put them in order and identify the procedural step that they're used for. And then that will be the completion of your competency assessment.